Well, first, I appreciate all the expertise. As I said at the outset, you all have been, all three of you have been sounding the alarm, and today you're able to give us more specifics as to how you would deal with the shortfalls that you see. I was curious in listening to your responses about how to not just make the structure more accountable and simpler, in effect. I think that's what, Dr. George, you are getting at. But also improve the technology. And one initial question I would have, maybe Dr. George, you could take this. You said that some of our adversaries have active bioweapon programs. What do our adversaries, and for that matter, our allies, do with regard to protecting their citizens from bioattacks? And what can we learn from them? Has the Commission been able to analyze comparatively what other countries do?
Mr. Ranking Member, I think when you're talking about the 4 countries that I mentioned, it's very difficult for the intelligence community or anybody else to figure out what they're doing to protect themselves or not. But what I can tell you is that Russia and China are investing billions into their bioeconomy, and part of doing that is investment in protective technologies, vaccines, personal protective equipment, and anything else that will bring the economic aspect of biology in the 21st century up to the next level. They are investing at a rate much greater than what we are investing here in the United States. It's going to start putting us at an economic disadvantage, but it's also going to put us at a protective disadvantage. I believe that...
And does that relate, excuse me, but does that relate to BioWatch and to the monitors as well?
I don't know,
yeah.
Senator. I would have.
How about our European allies or Japan or South Korea, other countries where we would have access to exactly what they're doing, and I would assume be happy to share that information. What have you learned anything from them as to how we could do a better job on detection?
Yes, Senator. I would say, especially in Europe, our European allies and other countries with whom we are friends are working on biodetection, and I think their approaches are different from ours. I think that they have viewed this as a technological challenge that needs to be iterated. We started with something in 2003 that the national labs produced, and 18 years, 19 years later, we're still kind of hanging around using that same technology. The Europeans have not done that. They have gone through their cycles over and over and improved. Now, nobody, including our Department of Defense and NASA, says that they've got the absolute solution that's going to work 100% of the time. But they're working on technology that's getting us closer and closer to that. And I believe we could get that information from our allies, our European allies, and possibly Japan, I don't know, if we asked.
Yeah, well, you're indicating they're ahead of us in terms of the technology, at least as to BioWatch and that responsibility. Let me ask just a basic question that I think a lot of people who are watching today might be interested in. Why didn't we detect COVID-19? Why did it take us so long? I think it was not until January that we actually felt like we had discovered this COVID virus when in fact it had been around for a few months. Maybe Director Curry, you could start on that.
Thank you, sir. Well, I mean, there's a lot of opinions as to why we may not have detected it as quickly as we want. But I mean, the point you bring up is about surveillance, surveillance is basically scanning the world for potential biological threats so we can get them as quick as possible and address them. And this has been a huge challenge across the agencies and the biodefense enterprise. And this is something we've pointed out, that multiple agencies have all tried to pursue their own surveillance systems. DHS has one, HHS has been trying to do one, DOD has one, USDA has one for zoonotic diseases. They've all been pursued separately. Some of them have not been successful, and they certainly haven't been integrated together. So I think part of the problem is the fragmentation and the lack of integration. But one quick point I'll make is during COVID, we've created some new innovative surveillance systems to monitor COVID and really get down into the state and local level in the private sector, in the hospitals and the pharmacies and things like that. And I think we need to look at what we created there and not just get rid of it when COVID's over. We need to use that to develop new surveillance systems.
Yeah, I know there's been some interesting research done for airports, as an example. Hasn't been implemented as far as I know, but there has been some research that could be quite helpful. Dr. Parker, any thoughts on that?
Sure, yes,
Again,
thank you. Yeah,
let me
and
just
I
give you the precise dates here.
Okay.
The first COVID-19 case that the CDC confirmed was on January 21st, 2020. And recent studies by public health officials suggest that it was undetected in the country a couple of months previous to that.
Well, I think it really comes down to the need to re-envision biosurveillance and take advantage of the lessons and the things that we did build, as was just recommended with our COVID-19. And the data analytics. I mean, it's really phenomenal now today for COVID. We can unpack and go down to the county level, the zip code level, and understand what's happening as far as cases, hospitalizations, and deaths. We didn't have that capability before COVID, and we certainly stumbled out of the gate with our laboratory diagnostics. That's been talked about ad nauseum, and we need to address some of those things in the future. And we need to address it that we're not just also focused on the public health. We have to focus on animal health. We have to focus on plant health. We have to take a One Health solution as we think about these our strategy. And we had a national biosurveillance strategy. Oh, I forgot. I mean, maybe it was 2012, 2013. It was some years ago. But I don't believe we ever had a very good implementation plan of that strategy. So COVID-19 has told us we need to re-envision what biosurveillance means and how we can do it and take advantage of our lessons observed and turn them into lessons learned. But it's got to be a One Health approach to do this.
I'm at the end of my time, but just quick.
It is inexcusable, the dates you mentioned, that now retrospectively, we believe it may have been in the United States before January. And so we got to fix those things in the future so that our laboratories can pick it up, and we're looking for the disease X's in the future.
It could have made a huge difference had we had the surveillance capability. Just quickly, I'll be hopefully get a second round here, but yes or no, do you think we have adequate surveillance capability for bio attacks? And just a simple yes or no, Dr. George.
No.
No.
Director?
No.
Thank you, Mr. Chairman.